Welcome to the first episode of Sequencing Stories, a podcast dedicated to exploring cutting-edge advancements in genetics and how they are transforming lives. I'm your host, Dr. Jeremy Koenig. On today's episode, we have the pleasure of speaking with Dr. Brandon Colby, a pioneer in the field of predictive medicine and the founder and CEO of Sequencing.com. Dr. Colby is a passionate advocate for using genetic information to prevent disease and to promote health. Now, today we're going to be diving into Dr. Colby's journey as it began with his own rare genetic disease, which ignited his mission to leverage genetics for better health outcomes. His extensive background in clinical genetics and preventative medicine uniquely positions him to lead Sequencing.com in making whole genome sequencing accessible and actionable. Dr. Colby's work is setting a new standard in the industry, offering innovative tools that empower individuals to take control of their health. In this episode, we delve into Dr. Colby's personal journey and how it inspired the creation of Sequencing.com. We discuss the evolution of genetic testing from single-cell panels to whole genome sequencing, and how this company, Sequencing.com, is making this technology, whole genome sequencing, accessible to everyone. In this podcast, you'll learn about the revolutionary tools offered by Sequencing.com, such as Next-Generation Disease Screen, Genome Explorer, and Health Scan, and how all of these empower individuals to take control of their health. Dr. Colby shares insights on the future of genetics in healthcare and the steps we need to take to make genome sequencing a standard part of medical care from birth. Welcome, Dr. Brandon Colby. It's a pleasure to have you.
Thank you, Jeremy. It's great to be here.
So there's a lot to talk about. Also, I should say I have the privilege of knowing you for 2, maybe even almost 3 years, actually, in our interaction professionally in the DNA industry. So I'm coming into this podcast with a huge advantage, knowing that I get to speak to you again, but also with the daunting task of putting together a concise and engaging conversation for our listeners. So given the speaker, I think I've got some assistance there. And the place that I wanted to start with is actually your book, Outsmart Your Genes, which, by the way, I love the ode to Richard Dawkins. And we'll get into why the title, I'm sure. But the thing for me that I think is most compelling, most heart-wrenching in the beginning of the book is, battling disease and suffering is my life's mission, and predictive medicine is the most powerful tool I can give you to maximize your health and prolong your life. And so it's a compelling vision mission, and I'd like to know, what was the origin of that mission? Because that is no simple undertaking, to say the least.
So I really have been interested in genetics. My whole focus on predictive medicine, on how it could help people from birth. I was born with a genetic disease, very complex name called epidermolysis bullosa simplex. Very rare. Few people have that. It means that due to a mutation in my DNA, my skin is extremely temperature sensitive. So although my skin, it looks normal, when I would just walk around, when it's very warm out, I'll have blisters all over my feet because my skin just cannot withstand normal temperatures like most people can. And this meant as a child, I was always sitting on the sidelines. I could never run around, play sports, have fun like most of the other children. And I would always sit there and I would ask my parents why I am different from everyone else. Why can I not do what everyone else can do? And the answer from my earliest memories was always, it's because of a change in your genes. So I knew from very early on, my whole psyche in terms of myself and the world was that, number one, my genes had put me on a certain path. And number two, I wasn't very happy with that path. I wanted to find out why I was there, why I was put on that path, but more so what I can do with that information to really usurp that control that I felt like my genes had upon me. And that very much dictated my entire career. I focused on genetics. I went to medical school focusing on clinical genetics and preventive medicine. And from there, I saw that the world of genetics, there was a tremendous amount of research, but there was very limited applicability of that research into medicine. It really was not translating fast enough from the bench to the bedside, going from the researchers to the clinicians. And that's when I started to really focus on ways to bring genetic technology more to the masses, more to the everyday person so that they can benefit from it as well. So it really all started from me being born with a genetic disease to then me becoming a physician and focusing on how I can utilize genetic information to improve the lives of everyone throughout the world.
It's interesting as you say this, and this isn't, the first time you and I talked about this. It didn't even actually occur to me until just now that your rare disease, I think, is the same one that my neighbor had. I remember what my neighbor's son had. I remember as a very young child always having these incredible rashes that would just break out in his knees and his elbows, like basically hot spots around, the back of his legs and over his entire body sometimes. And, interestingly, again, so how long this would have been in, I would say the early 90s that he was afflicted with this. And now I don't know for sure because they didn't know for sure, but they said, we don't know. We think it's food allergies. We're still working on getting this figured out, but it seems to be exacerbated, when he does activity. So yeah, it's just seeing that child grow up in comparison to his son, who is an avid golfer and tennis player, and so I can now better understand what you mean when you say, you kind of have to wait and watch on the sidelines. It's a really tough position for kid, not just kid, anybody to be in. So it's to me, it highlights on one of the things that you distinguish in the book, and that is the difference between, let's say a rare disease or something with like a pure genetic impact, and then there's the, let's say, common disease risk. So what is the difference really between something that's all genomic or something that's like, all genetic versus something that's genetic plus environmental? So I guess what I'm saying is there's probably, as I'm speaking to you, I'm thinking there's two audiences that are listening. There's people who know they have a genetic disease, and then there's people that know they have a genetic risk, looking at family history, for example. And so what's the difference, and what does know more about your DNA provide you with?
Bringing up about your neighbor also brings up an important concept that rare diseases, they have the name rare, but they're really not very rare when you look at there being more than 10,000 rare diseases that exist. So a lot of people know someone that has a rare disease. So that epidermolysis bullosa simplex may be very rare, but then there's more than 10,000 other rare diseases out there.
Right.
And it's estimated that everyone carries about 3 to 4 rare diseases within their DNA. We just don't know what they are. Usually they don't manifest. And we just have children with someone else that is not a carrier. So we continue to have children that have those rare diseases within their genomes. They carry them, but they don't manifest. And now we're going to speak about later on some technology where we can actually identify that. You mentioned the two really types of ways that genes can impact us from a disease perspective. One is where a change in a gene, a mutation, causes a very clear outright change in terms of like a disease. Like for myself, it's due to a mutation. That mutation causes that disease. So it's not really where it's a risk of a disease. I have that mutation, therefore I have that disease. And that really is the majority of rare diseases where it's you have a mutation and usually you have some form of that disease if that mutation is associated with the disease. There's also a whole range of diseases out there, almost all the chronic diseases you could think of that affect primarily adults. So cancer, autoimmune diseases, heart disease, and cardiovascular disease that have some underlying genetic component. So it's not where if you have a single genetic variant, you are going to have, let's say, cancer, but more so it's made up of a conglomerate of many different changes within your genes, each of them that is increasing or changing risk somewhat towards that disease. And then that has to be coupled with some environmental factors, such as whether you smoke, how much sleep you get, what you eat, how much you exercise. A lot of the common things that we hear for people to do to prevent certain diseases, those are usually having some interplay with the person's genetic risk in order to determine their total risk of a disease. So for a long time, we knew like something like, let's say, having low vitamin D levels was associated with a risk of a disease. But there was also a genetic component that was a black box. We didn't know about that. Now we do. So we can gain a much more complete picture of a person's risks. And the nice thing about genetics is that it exists from the time the person is conceived. So when that baby is born, all up until when eventually they'll die, their genome stays the same. So they have a risk of Alzheimer's, they have a risk of heart disease, they have a risk of cancer. That is very much, the genetic risk stays the same. And what we could do is modify the environmental risk throughout the person's life. So we do have that ability to outsmart our genes. We do have the ability to understand what path they're putting us on, and to actually modify that throughout life, because we can control all of these environmental factors that we're exposed to throughout our entire life.
Okay. Yeah, that's really clear. And if I play it back in a, like, say, a practicable way, I think about, this notion of say on the more minor side of the spectrum, like you may have, you have gene variants that don't allow you to metabolize lactose sugar, for example, and you could go through life perfectly happy if you never drank any milk products. In fact, that was true of my stepmother, who lived in China. And then when she moved here, to Canada, and the advertisement was basically milk as a superfood. And so her welcome to Canada was massive intestinal tract trauma, from that lactase persistence. So, I mean, it's a minor thing, but that's a pretty major issue, especially if you could never get to the bottom of it. But all kinds of issues, I think, around nutrigenomics that are really well studied, like, for example, like predispositions to not absorb things like vitamin A, or convert beta carotene from its, let's say, vegetable source to the retinol vitamin A source. A chronic lifetime of that could have profound inflammatory and immune system complications. It's this whole idea of, molecular triage, like the body will do what it needs to do to survive at the expense of, let's say, longevity. So let's call that's the the premium version, the luxury version, to live till we're 200. I mean, that would be awesome. And I think what you're saying is, these little adjustments that you can make about your with respect to your DNA helps you avoid that death by 1,000 paper cuts, which is pretty compelling, because previously people would just say, well, that's old age. But then moving into something, let's say, more like severe and compelling, well, it's actually on this notion of silent carriers. It's really quite fascinating that, rare disease, as you say, it isn't quite so rare. Like, your specific rare disease might be rare, but the fact that there are 10,000 of them, and the fact that everybody is probably a carrier, it's like, well, actually, rare disease is ubiquitous. And, we've basically got these, silent passengers, let's say. No different than, say, a silent passenger of a lactose intolerance gene. It's like, well, but when it comes in combination with another gene or the environment, you can get this negative effect. And the fact that, we're here today talking about this technology as something that we'll get into, obviously, in more detail, but something that you can even actually, well, your mother could have had when you were young and could have learned this specific pathology early. And that would have affected, I think, your life's decisions. And, I think about it as a parent as well. Like, you were really helpful with helping me to navigate some things that, I was concerned about with our daughter. Just the fact that, this technology is available today, even for parents, is quite interesting, which I'm sure we should talk about. Before we get to that, though, I did want to speak to this paradigm shift in terms of, well, noted in your book, around modern medical strategies. So, and I think this lends itself to what you're talking about, integrating genetics into healthcare. And that is, this idea of medicine's new pincer movement strategy. Can you explain that versus, like, the previous approach to medicine, let's say, as this new evolving paradigm shift?
Sure. The traditional approach to medicine, which we're all familiar with, is really reactive, where um, something is going wrong, you have symptoms, and you go to the doctor. The doctor attempts to diagnose and treat. And what we're seeing is that is really a losing battle, waiting for something wrong to take place and then trying to go and treat that. It already allows for disease to take a foothold. It costs a tremendous amount, and it means you're already sick before you go to see a doctor in most cases. A lot of times you go to a doctor, you're feeling healthy, and the doctor will be like, why are you here? So it's not really part of the traditional paradigm of medicine to get ahead of disease. The double pincer movement that I discussed in Outsmart Your Genes is really adding on genetic information so that we can predict what diseases a person is predisposed to. And that means that we can be proactive. So while being reactive will always be necessary, we're always going to need that part of medicine that is there to diagnose and to treat a disease that has already started to occur. What we can also do is now add on a whole nother strategy, which is to predict what diseases a person is predisposed to. And we could do that starting at when a person's a newborn, and then implement proactive proactive preventions throughout that person's life that will help reduce the risk of those diseases, either reduce the risk or provide for much earlier detection so that if those diseases do occur, that they have minimal impact upon that person. So the two really playing together gives us the reactive approach that we have now, but combined with this new proactive, predictive approach, gives us a whole new strategy for competing against disease, for combating it, trying to get ahead of it so that it doesn't get a strong foothold, if any foothold within us, and that we can live much longer, happier lives.
Mm-hmm. Mm-hmm. Well, it's interesting to be in a day and age where this is actually like I'm starting to see the benefits of this because I think about, back in my graduate school days, well, it was 2001 when the human genome was first sequenced, and there were all kinds of promises that were made, in terms of precision medicine, basically the genome being touted as our shared heritage and legacy. And this will be the future of precision medicine. And of course, that's politicians who are saying that, but a lot of scientists were saying that too. And I think from the public's point of view, when you look at it's around a $3 billion enterprise, you wonder when you're going to start to see the results. But, the interesting thing is, well, you are seeing the results. First of all, I can talk about price where, well, let's say it was $3 billion to do that first series of genomes. Well, now it's, 300 in some dollars to get your whole genome sequencing, which I want to ask you about in a minute here. But the actual application of having that whole genome sequence data versus just a few markers, has had, a profound effect on my life already, where I learned, for example, that I was a carrier of hearing loss, and potentially this could have been something that affected our daughter. It was true also on my wife's side. We didn't at the time have our daughter's whole genome sequencing. We are now on a path to doing it, but just the fact that my wife and I both knew that we were carriers, well, we knew to request the hearing test early so that, well, if she did have a hearing issue, we would get her fitted with hearing aids. And so she wouldn't miss that phase of social development as a result of sound. So that's, an example already of one intervention that I can speak to and asking a question, which, thankfully it wasn't an issue, but, there are others that have come up already, specifically already with diet, nutrition. And, I'm advantaged because I've been working in the space for 2 decades, as you have as well. And well, actually on that point is you wrote this book and Outsmart Your Genes in 2009. I'm interested to know, because you've been, I would say for all intents and purposes, leading the industry here. You wrote this book 15 years ago. What significant changes have you seen since then? And I have a suspicion that we're going to start talking about whole genome sequencing, but yeah, like what's changed since 2009, and how has your outlook bettered or worsened based on those changes?
So You're right. In the beginning, in the late 1990s and then early 2000s, when the Human Genome Project completed, it was thought that within a couple of years there'd be these magnificent like discoveries that would be made and advancements, and we would be able to go and utilize that information. But what we saw was that it has taken a tremendous amount of additional research on top of that, of knowing the complete human genetic makeup in order to get to truly actionable information. And after about 10 years, so in 2009, 2010, there was now a large amount of research that had been replicated, that multiple research groups had found, that had tied in different changes within genes to different diseases. But it was not being used by doctors. Doctors still, even today in medical school, they have maybe 3 weeks of genetics training. So it's still very much the focus of medical education is traditional medicine, that reactive approach that we talked about, waiting for disease to occur and then treating. So it is not really ingrained within doctors to look at all this research and find out how it can be used to get ahead of disease. Within the last 10 years, so since the book was written, the major advancement, you're right, is whole genome sequencing. That when the book was written, whole genome sequencing was still around between 10,000 to 100,000 a person. Started
Wow.
out at 3 billion. Then after about 10 years, it was, I believe it was around 100,000 at that time. Steve Jobs had his genome sequenced before he died, and I think he paid around $100,000 for it. Then several years later, it was down to 10,000. Now it's just under $400 to get your whole genome sequence, and the quality is much better than it was back then. So the quality of the genome sequencing, much higher quality than that first genome that was sequenced more than 20 years ago. So the decrease in price of whole genome sequencing has led to now the ability to obtain data on a scale that was never before possible. When I wrote the book, there was a type of DNA testing that was available called genotyping. It used something called arrays that would go and get more information at that time than was before possible. They would look at somewhere between about 500 to 800,000 data points within your genes. That's a lot of data points compared to what it was before that. But compared to the whole genome, that's about 2 to 3 billion data points. That's like nothing. That's less than 0.1% of a person's like genome is what we were able to capture back then 10 years ago when the book was written. And over that time period from then until today, now we can capture 100% of a person's genome that is cost effective. And we can talk about all the different advancements now that enables having that much larger data set. It really moves it into truly useful information, whereas before it was piecemeal and you could go and you could find tidbits of information. Now you could basically let the genome speak for itself with this massive data set and identify almost anything and everything that you could potentially be at risk for and create a much more comprehensive plan to live healthier and longer.
Mm-hmm. Mm-hmm. So, well, I love that, the distinction there actually, and I want to make sure that listeners got that, like the difference between these single gene panels that, might have been like a PCR reaction previously, then which have been a handful of genes, then microarrays were great, orders of magnitude more sequences, like hundreds of thousands. And that's the likes of, say 23andMe and Ancestry DNA. But actually that's what a lot of the labs were doing for research. I mean, in my graduate school days. So that really was the standard, previously. And it's been, I think, something slow to commercialize insofar as, the masses having access to this. And, the way you describe the genomics now makes me think back to the, original days when, like, the original heart rate monitors, they were these clunky things. I believe, well, I want, maybe it was Switzerland. I can't remember for sure the origins, but it doesn't matter. The point is that It was designed originally for people who suffer from heart attack, myocardial infarction. And so kind of like measuring their gradual return to normal physical activity, let's just say. But then you fast forward and it's like anybody who has a wearable, like they have a heart rate monitor. So, well, it was actually co-opted by athletes. And there's the whole idea of threshold VO2 max training was implemented into, strategically pulse the cardiovascular system to new levels intelligently and with data. And now, you're getting things like, resting heart rate or heart rate decay, or now even heart rate variability as predictive in terms of, general health and wellness, but also actually you're getting this information before the heart attack now, which is amazing, but super complex originally. Like it was, these exercise physiologists had to make it easy for athletes to use. And, the way they did that was just communicating, like, keep your heart rate within a percentage of VO2 max through these intervals. And, we have a theory that that's going to stress your cardiovascular system to a point of adaptation that you can maintain, and therefore set yourself apart and train your VO2 max in a new and interesting way, rather than just go out for a marathon run, so there's like a precision element that came into it at the highest kind of tip of the spear level. So I think about where, whole genome sequencing is now. And it's so like, who are our athletes today, right? Because like, there's no question that this will be mainstream and kind of at the center of everybody's health, probably from birth. But I'm interested to know, like you're one of the few organizations out there offering whole genome sequence. So we talked a little bit about what it is, the difference between microarray. And actually, I did want to emphasize this one point. It was, if it's like there's a football field, the previous analysis is like a few blades of grass, whereas whole genome sequence is the whole field and the sidelines. And so you really get this wonderful contextualization of, well, your genetic life code. So with that being said, is like, who is accessing their genomes today, and for what reasons? Like, so those athletes, they wanted to break world records. Who are the people accessing whole genome today?
And before we get into that, also it's important to look at how disruptive whole genome sequencing is in terms of the current model. And you mentioned single gene testing. There's still a lot of labs out there that perform single gene testing. Some of them charge in the thousands of dollars. So you could sequence one or two genes, you charge $1,500 for that. And there are more than 30,000 genes. So whole genome sequencing will obtain the full sequence of all 30,000 genes for far less than it costs for traditional labs to sequence one or two. And a lot of that is just built around the labs being very traditional, having this business model in place that they were able to make a lot of money on for a very long period of time, and not really wanting to invest in the latest technology. So it means that the consumer healthcare providers have very limited options because most of the labs out there just have not upgraded to this new technology, even though it is being used more and more by certain types of doctors, such as doctors, neonatologists, pediatricians. When they have a very sick baby now, a lot of times they do turn very fast to whole genome sequencing because it's been proven to be so helpful in leading to a diagnosis where before those children, those babies were sick and were unable to be diagnosed. And in some cases, whole genome sequencing has even led to treatments for them, whereas before those babies would have actually died. So they've had big wins in that respect, but it's still very slow to catch on. So that was one of my focus over the last several years, is how to bring whole genome sequencing to the public, how to make it really accessible, affordable to them, so that it's not where they have to go through a traditional lab, but instead at Sequencing.com, that's what we really work on, is to make that available so that everyone can have access to whole genome sequencing at a very affordable price for very high quality service. What we are seeing is that more and more people are having their genome sequenced that are interested in protecting their health. There's definitely a group of people that are interested just in knowing about themselves. We refer to them as quantified self individuals. Some people I've heard of, some people within that community niche called biohackers, people that are really interested in just learning what makes themselves tick, and how they can use that information, all the data that their body is producing, to achieve some goal. So that's definitely one group that we've seen in early adopters, but more and more we're seeing people that are really focused on using the latest technology to stay as healthy as possible to get ahead of disease. And those also that have some undiagnosed illness, that they have symptoms. They've been going to their doctor. A lot of them go to many doctors. They're on what's called this diagnostic odyssey. It's like a medical odyssey where they go from one doctor to another doctor. A lot of times they're told it's in their head or that it's just not able to be diagnosed. So then it just leads to a whole period of very heavy mental suffering for the person, for their family. They know that something's wrong, but the current medical establishment can just not help with that. We're seeing that there's a lot of interest from that community that then they're able to go and use information that they obtain from whole genome sequencing to work with their doctors. Whereas before that doctor was in doubt or didn't know where to look, then whole genome sequencing, when they present the findings to their doctor, is a beacon in the darkness. Now they have ways for that doctor to say, okay, now I can actually look at this. I didn't think of this before, but that the data is pointing me in this direction. So that it's what we're finding out very helpful to people, and a group of people that are using whole genome sequencing more and more. The last group are those that are parents that have a newborn and really want to do everything that's possible for that newborn. They're exposed to cord blood storage companies that are testing the cord blood from the umbilical cord, storing that in case the stem cells can be healthy, can be utilized in the future if the child is sick, in order to get them back to being healthy. So they're seeing that there's all different technologies that they're being exposed to when there's a newborn that enters this world. And now whole genome sequencing is becoming part of that insight that of new technologies that is possible. And we're seeing more and more parents, when their baby is born, turning to whole genome sequencing, getting that newborn sequence so they have that genetic information there in case it's ever helpful. So they do that initial analysis, they learn what can be useful at that point, but then going forward, they have the whole genome that's there. So if it's ever needed at any point, they can always tell their healthcare providers, they can always go and search through that genome themselves. It's this rich data set that now exists for them, that is there for them to access, for the healthcare providers to access going forward. And that we're seeing a lot of interest from that community as well.
Right, right. So we've really got the whole spectrum of human needs that are coming to sequencing.com, where you've got people who are in it to win it for the long game in terms of like the biohackers. You've got and the longevity seekers, and you've got people who are in pain now and don't have answers. I was talking recently to the National Organization of Rare Disease, and they basically highlighted the challenges segmentally, starting with the organizations who need the data to better understand the diseases to develop cures. And then the level down, let's say, is the practitioners. Well, how do I even use whole genome sequencing to help my clients or patients? And then the patient themselves, who, they may have access to some sponsored study, but it takes a year to get access to that, let's say, free test, but they're in pain now, or if they wanted a specific disease screen, it's thousands of dollars. And so, to know that, hey, there's this solution that's hundreds of dollars, and the turnaround times are just getting better and better. And we can talk about that as well, because let's be clear that the whole genome took like about a decade, and thank goodness you don't have to wait a decade for your genetics. But there is something interesting about sequencing.com beyond just the whole genome sequencing quantification, and that is the analysis and the knowledge translation. In particular, from my understanding, there are three flagship software products that sequencing.com has developed that, as far as I can tell, are like no other. And that is, besides the app marketplace, which we can talk about maybe a little bit later. These three flagship products I'm thinking about are the Next Gen Disease Screen, Genome Explorer, and Health Scan. Maybe we could talk a little bit about those softwares as, perhaps serving these different groups. How did you come up with these, and how are these solutions helping people now?
So the really basis of Sequencing.com is that we are a software company, that we see the major and the final gap in genomics before it can go and start to be applied to everyday people throughout the entire world, is really the translation of complex genetic data into something that is understandable, useful, digestible to the everyday person.
Mhm.
That it's now what we talk about whole genome sequencing. We can go and get a person's whole genome for under $400, but that turns out to be massive amounts of data that to most people it looks like the screen of the Matrix. Just streaming letters that doesn't mean anything really except to a geneticist, and that means that there's this gap between actually getting the data and then doing something with it. So while you may get 100 gigabytes of data, and unless you could go and translate that into something that is very easy to understand and use, it is of no value. It's just like a $400 paperweight that you have that's made of like ones and zeros, so binary code.
Mhm.
So Sequencing.com really focuses on that software solutions, on providing that last step towards making that data very accessible to a person. And that's what the three sequencing apps that you mentioned accomplish. Genome Explorer helps a person really dig into that data. So if a person is comfortable with data, if they want to go and search for different genes within their genome, if they want to search for different genetic variants, if they want to search for different conditions and diseases. It has a very complex like search feature, but that we made as simple as possible. So you can do all different types of searches, or just like Google, you could just type in something. It's almost like Google for your genes. You type in something and then it will return anything that's detected within your genome that matches that. So that's for people that are a bit more comfortable with the data. They want access to it and they want to dig into it. For most people, though, the primary concern is, am I at risk for something? Is my genome, like anything within my genome, putting me at risk of X, Y, or Z? And that's why we created Next Gen Disease Screen. That's a single screen. You can think of it as an analysis for more than 10,000 different diseases, conditions, traits, medication reactions, almost anything that can be identified on a genetic level. Next Gen Disease Screen will provide that assessment. So this moves away from just analyzing a single gene or a single disease, and instead it gets back to that concept that I talked about earlier of letting the genome speak for itself, of letting this massive treasure trove of data really speak for itself and guide the individual, and saying, these two things were identified that are very high priority for you to look at. These other things that were identified that may be important. Then there's some medication reactions that were important, all provided in a single interface that you could access online that's designed to make it very easy to go and understand that information. And you could, of course, dig into it. You could explore it further, but it presents it in a very straightforward way. And now the final part of the sequencing apps of the triad that we have is called Health Scan. It's the Health Scan app. This answers the question and solves the problem that I've seen for many years, which is genetic research is evolving and moving forward at such a fast pace that it's hard for a person who gets a genetic analysis to stay up to date with that. A lot of times labs will perform an analysis and then they never go back to that. You get a report, it's a PDF, it's static. And then what happens if tomorrow there's new research that comes out that impacts those results? And there is so much research coming out. Sometimes we see hundreds of new diseases are added to the national database, and then they're added to our system on a weekly basis. almost always on a monthly basis. Sometimes monthly, we have like in the thousands of either new genes, new diseases, new mutations that are identified, things that are changed, that new research comes out that found something that may have once been thought to be at high risk is now no longer because we have new research about that mutation. How do you stay up to date on all of this information? And that's where a health scan comes in. That health scan takes into context your genome, so it understands your entire genome, and then all the latest research that exists throughout the world. And then it will alert you if there's any relevant change that has been detected. So if there's new research that comes out today, next week, next month, next year, as long as you have health scan active, it will go and alert you at that time and say there's been something new that is relevant to you. So it's not that there's a new gene for this type of autoimmune disease risk that was just identified, but this research has came out that identified this mutation and your genome has that mutation. So this is very important for you to know about. And instead of waiting years for potentially that analysis to occur that's specific for that disease, what we do is we say, okay, there's this new research about this mutation. You have this research, you have this mutation, and HealthScan goes and sends you a alert, a notification, and provides you information about that. So you can go and you could dig into that information. You could go and review it with your healthcare provider, and you can stay up to date. So it solves that really final piece of the puzzle, which is genomics is moving forward so fast. How do you stay up to date with it? HealthScan is now the answer for that. So Genome Explorer, really for digging into the data. Next Gen Disease Screen is a single analysis for diseases, almost every known disease that has a genetic component, one analysis for that. And then there's HealthScan that provides any changes, any new information based on the latest research on an ongoing basis. And you get alerts going forward for the rest of your life. And any time that HealthScan is updated with new information, Genome Explorer and NextGen are also as well. So all these tools constantly stay up to date. We update our systems on a weekly basis. That's how fast things are moving. So on a weekly basis, we go and we assimilate more and more information. We don't do the research ourselves, but we use research that's performed by geneticists throughout the entire world, throughout all countries throughout the world. When it's published, it's high quality research. It goes into the national databases of genetic information, flows into our system.
It's interesting because I harken back to the title of your book, Outsmart Your Genes, and I referenced, the hail to the ode to Richard Dawkins there, an evolutionary biologist, let's say, and there are the evolutionary undertones there where if you even just think about how human beings evolved, well, we didn't always live to be whatever the average age is now, 79, 80, let's say. So we've got all these, let's call it like hitchhiker genes, potentially that are turning on as we age. And in fact, may be the culprits for aging and chronic disease. And so, the fact that you can actually get insight into what those predispositions might be and take action ahead of time, like, well, for example, is like, well, age-related macular degeneration is something that you can know and you can bring to your eye doctor, and you can modify your screen time, and you can get the appropriate glasses, and all kinds of nutritional things that you might do, as well. So it's interesting because really it's this notion of sequence once and query often, right? So you have all of the data. Well, the interesting thing too is that all the research hasn't been done yet, right? And that's what we talked about at the beginning, where this genome was sequenced in 2001 and we knew almost nothing. And now we're getting to a point where it's like, wow, it feels like we know too much, referencing your matrix and the user interface of this overwhelming data. But now we've got this Sequencing.com intervention or software solution to kind of shape the data into something that is digestible and actionable, but now also addresses the dynamic and ever flowing and changing, behavior of just, well, the scientific endeavor in general. I mean, that's why it's called research, right? Is you research. And so if you are using the software like HealthScan now, it's like, hey, this is something that becomes part of your annual checkup. But that's just for a healthy adult. Like, children, infants now I've learned it's like, well, they check in monthly, right? In adolescence, there's specific milestones where this becomes a resource as part of the discussion with the physician going forward. So that's really compelling, because now it's almost like I see it almost like as an investment portfolio where your health is the thing that you're investing in, and you have all this potential provided that you nurture it. And actually, one of the quotes of your book is use your nature to nurture, or you said something like that. How does that line go in your book? Is understand your nature to nurture it, or something to that extent?
Yeah, no, so understand your nature, your genes, and then you can go and you can change, manipulate, have control over your nature, your nurture. So
Love.
understanding your genes allows you to really have control over your environment, and that's where the whole concept about smart your genes has so much power that it's not where we can go and change our genes,
Mhm.
but our genes are only a piece of the total risk for the vast majority of diseases that exist. The diseases that most of us are concerned with, Alzheimer's and cancer, autoimmune diseases, that there's a genetic component. Now we can learn that genetic component. We could learn our nature, and then we can modify our environment. We can modify that nurture to go and to have a control over that total risk. So
Mhm.
while the risk of genetics stays the same, the risk of the environmental impact can change based on what we do. We can go and we could bring that down, and that brings down total risk.
Yeah. I want to take a second to just maybe acknowledge that some people are apprehensive about knowing. And, we've been talking a lot about how, well, it's just a matter of certainty that everybody's going to have access to their genomes. I mean, what's your feeling as to why people might be apprehensive? And, I think there's well, I just don't want to know. And I think that's fine. People are entitled to their own choices, and I don't think that's necessarily something we need to try to convince people around. I think it's more the other side, which is people who are concerned about privacy. It's like, well, how is this going to be used against me? I've heard of all these other companies selling my data. I'm not on board with that. I think
Right.
those are the people that are missing out, because they're like, well, I'm afraid that somebody's going to misuse this, so I'm not going to use it, and so I'm suffering from my own misuse. So how do we address that issue?
And as a physician, the number one killer that I have seen is denial. And it's not specific to genetics, it's just overall health. That when something could potentially be seen as like bad news, something that could be a bit heavy for a person to consider, a lot of times it's easier just to ignore that or to try to forget it, to feign that that even is of like relevance. And that is really what enables like a snowball for things to get worse and worse, rolling downhill. It gets larger, and then it's more difficult to deal with. So it's not something that is really specific to genetics. It's something that I've seen all throughout medicine. And part of overcoming this when it comes to genetics is understanding just how useful this information is. That it's not something where you're told you are going to get this, too bad. And like, it is what it is. And then from that point forward, you lay awake staring at the ceiling, worried about that and wondering why you had a genetic test. I think that's one of the biggest fears. And the almost all of the information that you learn from your genes is actionable. It's something that you can go and do something useful with. And one of the things that we've done at sequencing is to also make sure that it is the person's choice as to what they want to know. So that's through a whole concept of all different reports that we make available, where it's not just like a single report that will provide what we want to go and tell you. Instead, it's you can choose what reports you want to know. So if you're focused only on nutrition, there's a whole category of nutrition related reports and analysis on your DNA. If you're focused solely on fitness, there's that for you. If you want to go and improve your sleep, but you don't want to know about diseases, we have reports on that as well. And then, of course, there's some people that just want to know about ancestry, genealogy. We have reports for that as well. And you could go and you don't have to learn about health. So it's not where we come with a dogmatic attitude saying, this is information that you have to know. We try to present that health information in a very actionable, useful way that is not scary. But if you really don't want to know it, there's still a lot of other ways for you to go and get benefit from your genome. And you can go and you can access that without learning this other information. So that's really up to you to choose. Um, and then you also mentioned another reason why people are apprehensive, something that has grown a lot more significance of significance since the Golden State Killer. So when the Golden State Killer was identified through a public genetic database called GEDmatch, that's when the media really picked up on this concept and educated the population, like everyone in the world, that when you have a genetic test, if it's put into a public database, that it may be used in ways that you are not really realizing when you took that test or when you uploaded that data. So even though it's great that that person was caught, that they were found, it still raises the question of uh, do I want my data to be accessible by these unknown third parties, by law enforcement, or by anyone else? So we have seen that only increase in terms of people really being concerned about their data. We've seen issues with how other companies, consumer companies, have handled a person's DNA testing data, seen hacks. We've also seen, and media has helped with this also, to identify some business models that exist in the genetic testing industry where it's not really to benefit the consumer, the customer. Instead, it's to acquire their data and then you sell access to pharmaceutical companies. So people rightly so have become wary of DNA testing companies that offer very low price DNA testing because usually that means they're making money via some other like business model. So I'm well aware of that as well. I have that concern. And that's why at Sequencing, we created a very unique model where we do not have that model focus on third party payments. So we don't work with pharmaceutical companies. We don't work with insurance companies. We don't provide access to law enforcement. Instead, we focus on the privacy of that data and really providing a business model that goes and revolves around the customer. The customer goes and will pay us for service, will pay us for analysis, and then we go and we reinvest that money into improving the analysis, improving the experience for that customer, as opposed to using that customer's data and then selling it to some third party. So I definitely understand that concern. I think it's right for people to have that concern, but there are solutions out there that are developed, like sequencing, that take all those concerns into account and try to provide a platform for genetic information that a person can really be confident in, that they can feel like it's safe, that it has their best interest in heart, and that when they have that information stored at that platform, they're going to be able to obtain the information they want without risk of that data being used in some nefarious way.
Right. I mean, and that's a bit of an uphill battle, right? Where, already people were apprehensive about genetics, but as you said, actually, that was a really powerful statement. I want to make sure that I recapture, restate it. So you said something to the effect of, yes, as a physician, what you've observed is denial is the greatest killer, potentially, whether it's denial of, some symptoms or genetics as an underlying cause. So denial just doesn't do anybody any good. So then in terms of this privacy issue, so you've taken every measure, I think, to bring, the moral and ethic standard that you were trained with as a physician, the guiding principle of do no harm and certainly don't sell your patient's data. So, but nevertheless, you've got, these instances in the media and in the press that the general audience might need to overcome before fully trusting in having their DNA sequenced. And so there's that. But then what do you envision as Okay, so there's where we are today, and then there's the day when every parent has the genome of their child, right? And they are proactive and they are taking every steps possible to help their child put their best foot forward. What needs to happen, whether it's a technical limitation or a perception, for that hopeful future? So the informed parent, let's say.
So the great thing is that we are there today in terms of that capability that we can sequence a newborn, obtain all the data for their entire genome that's very high quality. That data will be stored securely and accessible going forward. We can use tools such as next-gen disease screen to look at everything that's known on a genetic level in terms of risk. And then we could stay up to date in terms of health scan on any new research that could impact that newborn throughout their life. So the tools are there. Now it's really about educating people so that they understand that this exists, this technology, that there are ways that companies have been working to do it correct, to really present it in a way that is accessible to the everyday person, and that has the security and safety and confidentiality in mind for the customer. That all exists, but a lot of people just don't know about it. So it's about education that this currently exists, and a lot of that is also going to come from the different governments throughout the world. So you mentioned a time when newborns are sequenced. And there are already initiatives in the US. So that's the NIH All of Us program that's sequencing up to 1 million people. They have about 750,000 already fully sequenced. In Europe, the EU, and also the UK, they each have their separate programs that are sequencing around 1 million people. In China, they're sequencing around 10 billion. Australia also sequencing up to 1 million. So there are all these countries that are now taking the steps forward that the outcome of all of these sequencing projects, the ultimate end game of them is to start to make recommendations for newborns that are born in those countries to have their genome sequenced at the time of birth. Similar to when a newborn is born now, they have a blood test. And sometimes it's referred to as a heel stick, where they'll get some blood from the heel of the baby. That will be tested from anywhere from about 15 to 25 diseases, things that can really cause very severe impact upon that baby, but there are ways to go and avoid that. So maybe different dietary restrictions that could go and save that baby from severe mental retardation if that blood test goes and identifies that that child is at risk before they're exposed to a certain type of food. So that's very real. That has existed for decades. Now, as the next evolution of that, it would be government switching from that single blood test, that heel stick, to whole genome sequencing. And that's what all of these initiatives are really setting up for. That governments just don't go and make a single recommendation. They need a lot of evidence. They need a lot of studies. And in the US, that NIH All of Us program is set up with the end game of making that recommendation for all newborns in the US to be sequenced. And eventually it will be something that the government will cover, and it won't be a recommendation. It will be a time when it's just done just like that. That heel stick is a requirement, that every single newborn has to be sequenced because of the tremendous benefit it has to that child and to our overall healthcare system, being able to get ahead of diseases as opposed to waiting for them to manifest. So we're on that path right now. And right now, it's very much by choice. If a person wants that, they have to be educated, know that that technology exists, and then they could get it through services such as Sequencing.com. Then it's going to be something that is promoted by governments at the time of birth. And eventually, probably within about 5 to 8 years, we're going to start to see governments requiring it. So first, it's going to be something that is strongly recommended. And then it's going to be something that is just so beneficial to the health of the population and to that newborn that it's going to become standard practice to do at the time of birth.
Wow. Wow. Well, it is an exciting time. And if I think back to when we started the conversation, we talked about, Brandon, the boy afflicted with these, just extremely severe blistering and pain, and evolved into the physician, evolved into the founder, CEO of Sequencing.com. Just in the final few minutes here, if we could think about where, that journey, where you've come from, what are you, let's say, most excited about in the field? Look, we've got things like artificial intelligence, we've got global networks, we've got the technologies that you put together, and then you've got, the practical know-how and the personal empathy that you can relate to all the customers. And so, given where you started from, what are you most excited about in the future?
One of the things I'm most excited about is that my own journey in terms of understanding my genes and the disease that I'm afflicted with, epidermolysis bullosa simplex. I thought that journey was complete, but one of the unknowns that I have always been faced with is that I have never been able to actually identify the mutation that was causing my disease. And as you can imagine, I've had a lot of genetic tests throughout my life. And it wasn't until I was able to have my genome sequenced and then I processed that data. I had it analyzed by Next Gen Disease Screen. I was one of the first people to use that technology that our team invented. That right away identified and pinpointed the specific mutation. So I know now information that I had not had throughout my entire life. And being a geneticist, I've studied my genome extensively, but I was never before able to find that needle in the haystack. It was just such a giant haystack, and it was impossible for me to go and identify that with any other tool. Now, Next Gen Disease Screen made that possible right away. It pinpointed it. And that information that I see that I now have would have changed the entire course of my disease, of my life. That if I think about the years that went on where my parents were not sure of the diagnosis, that they had to go from doctor to doctor to doctor until they finally found a dermatologist who heard about this rare disease and maybe that's what it is. And they were able to go and diagnose it based on a lot of deep skin biopsies, a lot of pain that I had to go through, all the suffering that my family had to go through in terms of not knowing what was wrong. Whereas this was something that existed right from the moment I was born. If I had my genome sequenced, if I had this Next Gen Disease Screen, they would have known that same day. The moment that Next Gen analyzed that data, that information would have been right there for them. So it would have solved that entire odyssey, that diagnostic odyssey, right away. It also goes and gives me a lot of information in terms of future family planning, being able to identify that mutation, being able to discuss it with my wife, and what that means in terms of whether we want to have children. If we do have children, there are ways to go and screen to make sure that that mutation is not passed on. So there's a lot of actionability that now I have that I never before had because of the Next Gen Disease Screen. So that was eye-opening for myself. It was a pivotal moment for our team, for our bioinformatics team, our engineering team, all the tremendous work and innumerable hours that went into creating this. It just worked so well that it was able to go and provide me with information that I never before had. So that is something that I am extremely enthusiastic about, that now we don't have to go really digging around into the genome and knowing where to look. Instead, we let the genome speak for itself. We run it through the different tools that we have, and then it identifies what is most important. It would have made a tremendous difference throughout my entire life. It already has, just for me going forward. And now it's really about enabling this technology to have that same impact for everyone else in the world.
Wow. So basically, when we reconnect and get together again in, say, months, years, or decades, whatever it is, we'll be able to point to, the number of people whose lives you've probably, because of this technology, because of the great work that the team of Sequencing.com has done, you've allowed them to sidestep this diagnostic odyssey. and get on with their lives and live in an informed way and truly outsmart their genes like never before. And so the fruits of your labor, are to, I think, reveal themselves in, well, they already are starting to, as I've seen in the rare community, in collaboration with Sequencing.com. So I think what you're saying is we're just going to see, well, a realization of your life's mission, which is ending the suffering through precision medicine. So, well, I look forward to those results and having you back and to talk, about some of the success stories that we're already seeing. Dr. Brandon Colby, I want to thank you so much for joining me today. This has been enlightening.
Thank you, Jeremy. Yeah, it's been great speaking with you.
Thank you for joining us on this insightful episode of Sequencing Stories. Today, we explored the inspiring journey of Dr. Brandon Colby, from his inspirational battle with a rare genetic disease to becoming a leader in predictive medicine. Dr. Colby's work at Sequencing.com is revolutionizing how we understand and use genetic information to improve health outcomes. We've learned about the incredible advancements in whole genome sequencing and the powerful tools that Sequencing.com offers to make genetic data actionable and accessible. These innovations are not just scientific breakthroughs, they are life-changing technologies that can help prevent disease, guide treatment, and enhance our overall well-being. I hope this episode has provided you with valuable insights into the potential of genetics to transform healthcare. If you found this conversation as enlightening as I did, please share it with others who might benefit from this knowledge. Stay tuned for more episodes where we continue to uncover the remarkable ways that genetics and scientific research are reshaping our world. Until next time, keep exploring, stay curious, and share the love. Thanks for listening.